So I walk out the front door and I see all these people standing around and just congratulating me on beating this COVID-19. And that was very touching. I mean, it grabs you by the heartstrings when something like that happens, and it makes you realize how many people actually care.
My name's Tammy Edwards. I work at MultiCare. I'm a registered nurse. I work in the birthing unit and on the postpartum floor. Our story starts with me being exposed at work to COVID and getting sick. The day before I got my test results, on the 9th, my husband Brian, he became sick. We just continued to take care of each other. And then over the next couple days, by Saturday, he was coughing much worse. The antibiotics were not working. He was sitting on the edge of the bed, and he was coughing so violently for probably 48 hours, was becoming delusional, kind of talking to, I don't know who he was talking to. He said, "Call 911, I can't breathe." They took him, they put him on a stretcher, and I kissed him on his cheek. I gave him his phone, and I said, "I love you, and please fight this." And they loaded him into the ambulance. I had a really hard time closing my front door because I felt like when I did that, it was probably going to be the last time I ever saw him. So that was really hard to do. He was put on a ventilator, and he was on one for 11 days. He was within hours of dying. Then they gave him a plasma transfusion from other COVID survivors, and that seemed to help. And then they gave him the remdesivir, and he was on that for 10 days. And he was given 30-minute infusions for 10 days, and he was able to finally pull through. And after 26 days of being in the hospital, he's home with me now.
He was one of the patients from the trial that we were doing at MultiCare at Tacoma General Hospital at the time. At that time, we had placed our bets on a drug called remdesivir, and we had decided to go along with that because that was a drug that was used by Snohomish Hospital in their index patient. And when he came along, he was pretty sick at the time, and we still decided to give him this particular drug because that was the only option we had. And I'm glad we did that because the results are now obvious, but when we started, we were not sure at the time. What this disease has outlaid is that it's spread research very thin, but it's also spread it out throughout small places, large places, primarily because we have no idea what's going to work, and it's difficult for a large institute, whichever one you pick, to do research on everything that is out there, everything that has been repurposed, everything that is being investigated, everything that is being brought forth. I think there is a significant amount of hope. The folks in this community need to understand that we have everything that would be required or that is needed to treat this, and we are moving in the right direction. And whether it's by luck or by choice, we seem to have picked the right candidates. And if you look at our numbers of how we have treated our patients at Good Samaritan, they should be proud of us, what we have done.
We need to pull together and do this for the greater good, because no matter what the politicians say or what's going on way up high, us as people, we need to take care of each other, and we're not going to be able to open up businesses. We're not going to be able to open up the public schools and let the kids go back to school if we don't do this for each other and for ourselves. We just need to take care of each other. There's a purpose for everything, and I'm hoping that our story will stay out there and people will see this is not a hoax. This is not a conspiracy. This is real. And there's thousands of people like us. Many people don't get this end result. Brian and I want to thank the community for what they've given for donation, for research, and we ask that they continue to do so, even more so now with what we're seeing as far as numbers, and it's going up, and COVID-19 is going to be sticking around for a while. We appreciate everybody that has donated and given to the MultiCare research teams for COVID-19. and we hope they continue to do so. We have the most amazing doctors and nurses in MultiCare, and they need your help.